welcome to Let's Talk About It. Tonight, we'll be talking about dental implants. Dental implants is another procedure for replacing missing teeth that are not your grandmother's dentures, nor your aunt's bridge work. And utilizing the latest technology and treatment modalities, I have with me my special guest, Dr. Jean-Pierre, a dental specialist in gum disease, also known as a periodontist. Dr. Pierre completed his undergraduate studies at the University of South Florida. He received his Doctor of Dental Surgery degree from Meharry Medical College, School of Dentistry in 2003, where he was recognized with an award for an outstanding achievement in periodontist. He went on to complete his periodontal specialty training at the University of Tennessee, Memphis in 2006, where he received his Certificate of Specialty in Periodontist and his Master's of Dental Science degree. He was also an associate professor in the Department of Periodontist at Meharry Medical College, and he established the Periodontal Care Center in July of 2006 in Hendersonville, Tennessee. Dr. Jean-Pierre, I want to welcome you to the show this evening.
Thank you, Erica. It's my pleasure to be here.
Now, I know with some other things that I did not mention that I would love for you to tell the audience about, because I know that you are on various boards as it relates to periodontal. Did I say that right? Am I saying that right? You know.
Periodontics.
Periodontics. So
sure.
I know it's other boards
yes.
that you're on. Can you explain to our audience what that is?
Sure. You know, with any specialty, you know, we are members of, say, American Academy of Periodontology,
okay,
and also the American Board of Periodontology, and some local society, such as the Tennessee Society of Periodontists and the Southern Academy of Periodontology. And various others. So.
Wow, so
yes.
you're a member to all of those?
Yes, I am, yes.
In addition to your education?
That's correct, yes.
Well, I know with that education and that knowledge that you're going to bring a lot to this discussion as it relates to dental implants. But before we even get started talking about dental implants, I want you to explain to the audience, what is a periodontist?
Well, as a periodontist, I devote my practice to the treatment, prevention, and diagnosis of various forms of periodontal disease, as well as the placement of dental implants.
Okay, yes. So I can kind of read between the lines. Mm-hmm. You are a specialist in some form of dentistry. Will you tell our audience what that is?
Well, yes. As you know, there are 8 different recognized specialties in mm-hmm. dentistry alone. And as far as periodontology, basically we focus on the treatment basically around the tooth, known as, you know, gum disease, which we treat mostly surgical, non-surgical, and laser treatment and various forms of treatment.
Okay. So you are a specialist of the gum, which is perfect for dental implants, since the dental implants goes within the gum, which we'll talk about later. So let me ask you a question.
Sure.
There is a difference between just being a periodontist and a board certified periodontist. What is that difference? And tell me, what is the benefit of being board certified?
Well, you know, as a periodontist, I went to an additional 3 years of training, mm-hmm. and from there, the final stage is to become board certified. Okay. And only 1/3 of periodontists do become board certified. It's where you are tested by your peers as far as, you know, going through an oral board and a written board to be able to be certified.
Okay, so how does your practice differ from just a regular general dentist?
Well, we focus mainly on the patients who have advanced gum disease, okay. or patients who are missing teeth or okay. have dentures that are loose that need stabilization. So we treat all forms of, well, as I mentioned, gum disease, and we do aesthetic treatments like gum grafts and different things. And whatever the patient needs.
Okay, so if I go to my dentist and I have some things that are going on that are a little advanced as it relates to my gums, he's going to send me to someone like you.
That's correct.
That's
yes.
correct. All right. All right. Now, this evening we want to talk about dental implants. And, well, what is a dental implant? Because that's not a term that we hear a whole lot. Well, it's becoming, you know, we hear it more often now than we used to. So can you explain to the audience what is a dental implant?
Sure, I'll be happy to. As you know, many people started having just what we call partial dentures, where they used to take it in and out, which they still do. However, a dental implant is a titanium post. It is placed in the jawbone surgically and allowed to heal. And then once that heals, we place another post on that, which then we place a final crown on it that mimic the tooth that was missing. So basically, a dental implant is a wood replacement structure that's placed in the jawbone.
Okay, and it's surgically placed in there.
That's
and
correct.
I know you're going to tell us the process a little bit later.
Sure.
Well, how long have dental implants been around?
Well, dental implants have been around for about 40 years.
Wow.
It started by Dr. Brennemark. He initially placed dental implants in the jawbone to stabilize dentures.
Okay.
So he was amazed on the process, and from there, you know, it kind of evolved from there.
So are dental implants becoming a standard of care, or is it becoming a more realistic option for patients?
More and more is becoming a standard of care as far as the gold standard for wood replacement.
Okay.
And it is really the way of the future.
Wow, okay.
Yes.
So what are the benefits, since it's becoming the way that we're heading as it relates to replacing missing teeth? What are the benefits of a dental implant?
Well, the benefits really, it looks like a tooth. You know, it's natural, very natural. It can bring someone their smile back. And not only that, say if someone has a denture that moves around, 2 dental implants can be placed to stabilize that denture, where they can enjoy, you know, like corn on the cob or a good steak, you know.
Of course.
And then also it's brings someone say needed a bridge. Instead of having a bridge, now you can have only a single implant to replace that one missing tooth there.
So what has changed over the last 10 years? What has made the process better?
Well, a lot has changed as far as the treatment time, the technique, you know, and also just the way the surface of the implants from where they started. So initially it started what they called subperiaxial implant, where it was just placed on the bone.
Okay.
And then it moved to what they call blade implants, where they just put it in the jawbone, where it just fits in the jawbone. And lately we've gone through endoosseous, where it's just a post that's placed in the jawbone that simulates a tooth, a wood tooth.
So all of the, I'm sitting here processing all of these procedures. They've all been surgical.
Yes.
They've all been surgical. So 10 years ago, what was the downtime for this process?
Well, 10 years ago, we used to wait a longer to, as far as we will place an implant and then place it under the gums, stitch the gums, and then allow that to heal for 6 months. Then we come back, uncover that, and then place the post to get the final restoration. Well, nowadays, based on the condition and the situation, we're able to place implants, you know, where it needs to be, and allow it to heal for as little as 2 months.
Okay.
And then we restore that.
So in that healing time of 2 months, I guess I'm trying to visualize what happens. You know, you put a post there and nothing's there to cover the post. So what's there for those, you know?
Well, yeah, depending on the case. So really it's the gum basically covers the implant. Say if it's in the back of the mouth, that's no problem.
Okay.
Now what we can do is, if it's a front tooth, in front of the tooth, I'm able to place a dental implant to where I can mimic a tooth, what we call a temporary crown, to mold the tissue while it's healing, and just you know, to allow someone just to not to walk around without any teeth. So,
okay.
yes.
So and I think that's what I was getting at. I know the
Sure.
was like, oh, okay.
Yeah.
So they are just like when you're getting a root canal, and while you're waiting on your permanent crown, you get a temporary crown. Same difference here.
Sure.
Now I know that while they're wearing the temporary crown, they can't function as normal or eat the same things as they would because of I know it's not as strong.
Sure, yeah.
So they have to be mindful of that. Well, what about those clients or patients that are even thinking about, they know they're going to have to lose some teeth, but they're up in age, and it feels as if they think that they're just a little bit too old. They hadn't even seen a dentist,
Sure, yeah.
but they think, you know what, I'm too old for that. I have osteoporosis, my bones are weak. I just need to get a partial and just don't even worry about this procedure. What do you say to patients that self-diagnose themselves?
Sure, yeah. That's very common. We have a lot of patients who do that, as like you said, they think they are too old or they self-diagnose. But depending on the case, now we're able to take what we call CAT scans to be able to see how much bone is available even before placing the dental implant. And not only that, there are even other ways to go about placing those even without reflecting the tissue in many cases. So it's not a matter of they are too old, it's a matter of how much bone is there and what can be done in that situation.
So basically, stop self-diagnosing. We can't help it.
I understand. Yeah.
So what are the different categories of patients who are eligible for dental implants?
Well, yes, the patient who is missing one tooth is a great candidate for dental implant. Then you have patients who are missing more than one or 2 to 3 teeth, where they can have what we call an implant bridge. And those are also patients who have dentures that are not fitting properly. They can have basically at least 2 dental implants to place in the jawbone and to be able to stabilize their denture for them. So in that case. And nowadays we can even place only 4 to 6 implants to replace a whole set of teeth. So.
Oh, really?
Really.
So what you're saying is instead of having to put a post in each slot, you can just basically create, I guess, a denture, but it kind of snaps on the 6 posts in the gums?
That's correct.
I need to be a periodontist because I caught on to that.
You might as well do it, yes. It's never too late. Yeah.
So, Dr. Jean-Pierre,
Sure.
can you kind of dispel some of the fears and the misconceptions that people have as it relates to receiving a dental implant?
Okay. Well, yeah, sure. It's very common. The first misconception is that they feel like dental implants, it's expensive. It's not affordable. Where I say no, not really. It is affordable. And then another misconception is that they say it will not work for them. So basically, dental implant, the way it's made, it's made to fuse to the bone, and the bone loves it, so it will work on those people.
So what can a patient expect during the process?
Well, really the process, I would say it is less involved than having some wisdom teeth extracted. It's that simple, to where we just make sure they're comfortable, and what happens is when they come in, we first diagnose what needs to be done, and then when they agree to go ahead for treatment, we basically plan the case even before they come in, to where it's gonna be placed and how it's gonna be placed, to make sure we have a good end product. And from there, once that's done, they come in for the surgery, which time the tissue is reflected, and we basically a hole is placed in the bone, in the jawbone, to where the dental place is placed, and then the tissue is sutured. Well, stitches are placed around the dental implant, and then they're allowed to heal. Now, depending on the case where it's made, that would be the case there, to depend if it's front teeth or back teeth. And from there, once it's healed, we come back, put a post on that, and let them hear and place a final restoration by the general dentist.
So this is not just a one-stop and you're done type of procedure.
That's correct.
This is a procedure that is done in stages.
Exactly. Yes. Now, in many cases, it can be done what we call the single stage or immediate placement, to where I will place the implant and then place the temporary crown at that time on that day, so they will not be going around without any missing teeth.
So would you also place the crown, or you only do the implant portion of it? Do you work side by side with the general dentist? So you do the implant and dealing with the gums.
Yes.
I guess you're saying reflecting, like kind of cutting the gums open.
Sure, yes.
And making sure it's there securely. And then you work with the general dentist, who will make the permanent, I guess, tooth for that implant. Is that how that works?
Exactly. You see, the whole process is a team effort.
Okay.
You know, from where they come from, the general dentist, and the patient also has their part as far as that goes. So basically, once the dental implant is placed, we collaborate with the referring doctor to be able to get them where they need to be, and to the final product they desire.
All right. Well, I have an important question. Once I come to your office, this is important.
Okay.
How soon can a person go back to really eating their standard of eating, like the corn on the cob and the chicken and, you know, just regular macaroni? You were in the South, macaroni and cheese.
Yes, I know.
How long can a person go back to eating in an ideal situation once they've had this, started this procedure?
Okay. Well, in an ideal situation, basically, we tell patients to at least they'll be on a soft diet the first 7 to 10 days.
Okay.
And then they gradually eat as they are healed. So
soft diet, soup, mashed potatoes,
right, exactly.
Things like that.
Exactly.
Is that not only to keep from damaging the actual implant, or is it just a pain management?
It is both. Basically, just to allow the soft tissue healing around the dental implant, and you don't want things becoming open that may risk infection in that area. So
okay, and that's a good, because that was going to be my next question. Sure. How likely is it for a patient to receive some type of infection from this procedure, because we are opening up the gums and we are placing something foreign in the jawbone? So how likely will a person experience some type of?
I'm sorry. Yeah, it's very unlikely, because what we do is cover patients with antibiotic to prevent any infection, and once the site is closed, really it's more like, you know, everything is done in under sterile condition, and to where we minimize any of that also. So,
so when people lose their teeth and their face kind of sinks in, I know you have brought a video to kind of show what that looks like. Can you tell us what we're looking for in this video?
Sure. Basically, what you'll be seeing is the morph that takes place as the you know, the face sinks in. You have the chin sticks out, and the lips sinks in, and the creases gets deeper, and that's just showing you what the process on as the patient loses bone. So
okay.
Yes.
Well, let's go ahead and see that video now.
I am Dr. Jean-Max Jean-Pierre at Periodontal Care Center. You may be wondering what a periodontist is. Well, I devote my practice to the diagnosis, treatment, and prevention of various forms of periodontal disease, as well as the placement of dental implants. I also perform surgical and non-surgical treatments. Today, I am going to talk to you about dental implants.
So, doctor, if I understand you right, and based on the video, it is actually the implant on in the jaw that keeps the bone stabilized and.
You are correct. Yes, basically what happens is the dental implant in the jawbone stimulates the bone to stay there. And just like our natural teeth, we have the roots in the jawbone that stimulate the bones to stay there, while the implant is now doing the same process to keep the vitality of the bone.
Oh, wow. So the implant actually keeps the bone healthy.
Exactly.
Oh, awesome. So what would be your ideal group of patient that you would want to see as it relates to getting a dental implant, because we know this is still a new process?
Sure.
What would be your ideal group of patient?
Well, yes. Well, you like I mentioned earlier, you have those patients who are missing one tooth. Those are great candidates. Those who are missing more than one tooth, or they can get an implant bridge. And especially patients who are in dentures. Again, if the denture moves around or lifts or it comes out when talking, those are great candidates. Now, many times we have patients who have been told all their teeth have to go. As you know, no one gets excited about that. So, but there are other options to where we can help keep some of their teeth as well.
So what you're saying is, if you've been told by your dentist that, you know what, I'm sorry, you have to have these 5 teeth removed, not to necessarily get discouraged, because it's not like you can't have something else in place that would kind of stimulate or simulate your natural teeth and still keep your mouth healthy. The dental implant is actually that way to go instead of a denture.
That's correct, yes.
So really what you're saying is a dental implant is more so of that long term, I want to keep my mouth as healthy as possible, and even though I may be losing a few teeth, I can still save my gums or my bone, and maybe the rest of the teeth in the mouth.
That's right, you got it. Yes.
I think I'm gonna be a dentist. So let's kind of review some things.
Sure.
We've talked about the dental implant and all the technical aspects of it, but really to sum it up, it's seeming like the dental implant is less pain. The process is been cut down. We haven't talked about the financial aspect of it, but it just seems like it gives a person a new look on life as it relates to teeth. Can you kind of sum that up for me?
Well, sure. As just like you said, is a low down time. The surgery time now, it's you don't have to wait as long to get the final restoration, and you can get back to life as far as getting your confidence back, and as far as smiling comfortable, okay, and self-esteem also. So
one thing that we didn't talk about, the financials.
Well, implants are affordable. There are many options nowadays to where it can fit into anyone's budget.
Okay.
Yeah.
So it's kind of comparable to just getting a regular denture.
It is, yes.
Okay. Well, I know that we have another video that gives us some before and after shots of persons who are missing some teeth, but who now have dental implants now, and I bet you can't even tell a difference.
Yeah. Well, we also have some testimonials of some patients that I've treated, so we can take a look at that.
All right. So. Let's cue that second video.
Dental implants give a person back their confidence. Dental implants can do anything that normal teeth can do, from smile to eat. With my help, people are rediscovering the comfort to eat, speak, laugh, and enjoy life.
Before the implants, in terms of smiling, I covered my smile. And I've always been a person with a big smile, and I would compensate for the missing teeth. I was not able to eat on the side where the teeth were missing. And so now that I had the implants inserted, that's not a problem anymore. I can chew on both sides and I can enjoy my crunchy food.
Dental implants are the recognized standard of tooth replacement because they have the highest success rate. They are the least destructive, the longest lasting, and most natural tooth replacement. I believe they should be mentioned as a treatment option in addition to standard dentistry such as crown and bridge or removable partial denture.
It's hard to wear bottom dentures. Some people can, but some people can't. It's a denture, and the denture's got a hole in the bottom of it, and the implant's down here, and it is snap on.
There are many different categories of patients for dental implants. The patient who is missing one tooth is a great candidate for a dental implant. The person who is missing perhaps 3 teeth can have an implant bridge instead of replacing each tooth. A patient who has an ill-fitting denture who cannot taste their food any longer and their denture moves around in their mouth is also a great candidate for dental implants. It's all about function and aesthetics.
Several years ago, I experienced some trauma to the front tooth and had it capped, and over a period of time it set up some infection. I went to my family dentist and he recommended Jean-Pierre to do some surgery to remove the capped tooth and do the implant. I feel much better now because the tooth is much more natural looking than it was before, and of course all of the infection is gone and the experience is much better.
We at the Periodontal Care Center will deliver the most up-to-date care to you.
He was really good with me. His nurse was so kind to me. She would sit there and just hold my hand.
Dr. Jean-Pierre, I want to thank you for that video. It was so enlightening, and you couldn't even tell that the patients even had a dental implant. So I want to thank you for coming on the show this evening.
Well, it was my pleasure to be here, Erica.
And thank you for educating us on the dental implant and how it can become now a standard of care.
Yes.
And thank you, Nashville, for tuning in this evening. I'm your host, Erica Battle. Good night.